What is a pyloroplasty? Have you ever wondered how a surgical procedure can help with digestive issues? Today, we are going to talk about pyloroplasty and its role in specific digestive disorders, especially in relation to gastritis and stomach ulcers. Pyloroplasty is a surgical operation aimed at widening the opening at the lower part of the stomach, known as the pylorus. This area is surrounded by a muscle called the pyloric sphincter. This muscle acts like a valve, controlling the flow of food from the stomach into the first part of the small intestine, called the duodenum. Normally, the pylorus opens to let food pass and closes to prevent backflow. However, when the pylorus becomes too narrow or the muscle too thick, food cannot move through easily. This can lead to symptoms such as nausea, vomiting, bloating, and discomfort after eating. During the surgery, the muscle around the pylorus is cut and relaxed to widen the opening. This allows stomach contents to empty more freely into the small intestine. There are different techniques for this procedure. One method involves making a lengthwise cut in the muscle and stitching it open. Another method connects the stomach directly to the duodenum. The surgery is typically performed under general anesthesia and can be done through a traditional open incision or with minimally invasive techniques using small cameras and instruments. Pyloroplasty is most often used to treat complications from peptic ulcers that cause a blockage at the pylorus. It is rarely performed on its own and is usually combined with other procedures, such as vagotomy, which reduces stomach acid production. While this surgery can be effective for certain structural problems, it is not a standard treatment for general digestive symptoms like those seen in irritable bowel syndrome or colitis. These conditions involve different parts of the digestive tract and have different causes. For individuals with sensitive stomachs, irritable bowel syndrome, or colitis, it is important to know that pyloroplasty is not a typical solution for their symptoms. These conditions usually involve inflammation, motility issues, or sensitivity in the intestines rather than a mechanical blockage at the stomach outlet. However, if someone with these conditions develops a separate issue like a pyloric obstruction, possibly from scarring due to severe ulcers, pyloroplasty might be considered as part of their care. If you have a sensitive stomach, irritable bowel syndrome, or colitis and are experiencing new or worsening symptoms, it is essential to discuss them with your healthcare provider. They can help determine if your symptoms are related to your known condition or if another issue, such as a pyloric obstruction, needs to be addressed. Always seek medical advice before considering any surgical procedure, as the risks and benefits must be carefully evaluated, especially for those with ongoing digestive sensitivities.